High cholesterol in children is on the rise, and the signs aren't always obvious. Like most things, managing it early can avoid more serious health issues by the time they become adults. Dr. Stephen Lorch and Dr. Joshua Quiñones with Modern Heart and Vascular are here to share more on what you need to know to keep your kids' hearts healthy. Good morning.
Good morning.
All right, a little bit about you, Dr. Lorch. You are new to Modern Heart and Vascular, but you have 20 years plus experience, and especially dealing with kids.
That is correct. So I joined Modern Heart and Vascular about 2 months ago, but I've been here in the Houston market in various positions for about 20 years.
Yeah, and Dr. Quiñones, you also deal with pediatrics and heart, which sometimes is confusing to people because they always think it's heart disease is with older people, but there are all kinds of things that can impact the heart, even in utero.
Correct. Some babies are born with heart abnormalities that need immediate attention, and that's what Dr. Lorch and I are here to help with.
Yeah. All right. When I first heard high cholesterol in kids and high blood pressure, I thought, wait a minute, that's something that only happens to older adults. But then I remember several years ago, the CDC came out and said, we're literally looking at a generation of kids who might not live as long as their parents because of type 2 diabetes. So we know that diabetes can happen, childhood diabetes, but this is type 2 diabetes and the obesity rate. So is this connected to those findings?
Very much so. So this is all part of the larger metabolic syndrome that we find in adults. Unfortunately, now we are finding it more in kids.
Yeah.
And it has to do with poor eating habits, poor exercise habits, and overall just not taking care of your body.
Yeah, let's explain high cholesterol and high blood pressure, because it's out of sight, out of mind for us. So what exactly does it do inside of the body that's not advantageous?
So high cholesterol and high blood pressure can cause what we call atherosclerotic changes within the heart, and they can basically cause the arteries inside of your heart and inside of your body to harden, and thus in adults they can cause heart attacks and strokes. In kids, most of the time it's silent. We don't even know that the kids have high cholesterol. We don't know that the kids have high blood pressure.
And no one would check for that. I mean, most people wouldn't, right?
So the AAP and the AHA have now come out with guidelines saying that every kid should have their cholesterol checked sometime in their early teenage years.
Yeah. All right. So I think that a parent might think that if they have a child that might be dealing with obesity, but we're even talking kids who appear to be healthy.
They otherwise look normal,
yeah,
and they're just walking around being kids. But because of what we're eating and because of what we're doing, they're not healthy.
Yeah, okay, so sticking to that, the foods, important. And it's just that the foods are different today than they have been in years
Correct.
past. And this is, I think, the first generation that's really catching up to that fully processed type of food.
Yes, the foods that we all kind of love and enjoy can sometimes be the worst for us. The things that we watch out for with high cholesterol and high blood pressure would be salty foods, fatty meats, when we should all we know that we should go towards fruits, vegetables, and cleaner foods.
Yeah.
Things not in crinkly bags, as Dr. Lorch likes to
Things that
often
are not
say.
in crinkly bags.
Yes.
Or if there's some meat that's good from now until like next May, you might want to ask yourself, is that the best thing with there? Because usually you got things in there that are preserving them that are not good for us. All right, high cholesterol levels, some of the signs and symptoms I mentioned earlier that kids might not present the way that adults do, but what are some of the things to look out for that would cause concern and prompt a parent to bring their child in?
Well, high cholesterol in particular can be very silent until eventually it's not. As in adults, they have heart attacks. In kids, luckily, it doesn't progress that quickly, but it can still lead to early heart disease in your 30s and 40s. Wow. High blood pressure can also be silent, but things that you could watch out for would be frequent headaches, frequent nosebleeds, chest pain with exercise, could all be warning signs that something could be going wrong.
Yeah, all right. And there's ways to minimize high cholesterol and high blood pressure in kids. And so one of the first things that you all would do when someone would come in, if that's the case, is you'd say, okay, let's work on some of the things that we know can make an impact through our food source, one, right?
Absolutely. Yes, so we want to make sure that we'll take a dietary history, and we want to make sure that the kids are having a low salt diet, make sure that they're minimizing the fatty foods, make sure that they're eating a healthy, balanced diet, fruits and vegetables, making sure that they're eating the right portions. So after you go through your first pile of plate, sit down, talk with your family, talk through the day, figure out what's going on. And then if you're still hungry, go back for a smaller second portion.
Yeah. And a second portion of something that's good is like more broccoli.
Exactly.
More broccoli, please. Have all
Exactly.
you want, right? And kids oftentimes will do what they see their parents doing, and we know a lot of it is based in convenience, but a lot of it's also based in just not knowing. You think something looks like it's right. Somebody the other day came up to me. She goes, "Well, I was giving him a spinach pasta." And I said, "Let's look at the ingredients on the back of this thing. There's no spinach really in here, right?" And so, just being wiser about what you're choosing, because we do understand that can be confusing in the grocery aisle.
Yes, the label on the back is what you want to look at, not the pretty colors on the front that they're trying to advertise. There's one piece of broccoli in this whole meal. And as you were saying, kids take after their parents, so modeling those good exercise and eating habits are really important, and having family buy-in. Because if you just have one child with high blood pressure and they have to eat well and everybody else is eating all this bad food, they're going to feel left out. So making it during the holidays, it's supposed to be familial and happy, and everyone should take a part in controlling their health.
Yeah, but at the same time, you can enjoy things, but not all the time.
Moderation is key. Absolutely.
And I just want to round out with Modern Heart and Vascular. What's great about you all is you can treat the entire family.
Exactly. We have a very large practice. We have both pediatric cardiologists and adult cardiologists, and we are scattered throughout the entirety of Houston, and we are ready to take care of you from birth all the way through.
Yeah, and not just the heart as we know it as the heart, but also the vascular part with vein disease and all those things as well.
Absolutely.
All right, gentlemen, thank you very much.
Thank you.
Thank you.
All right, Modern Heart and Vascular Institute can see patients of all ages, as we just mentioned. They have several locations throughout the greater Houston area. To book an appointment with a board-certified cardiologist, visit them online at modernheartandvascular.com. You can also give them a call at this number, 832-644-8930. Again, that's 832-644-8930. Hold on one second. I want to ask you another question. Also, can certain medications that kids are taking, a lot of kids are on different things for ADHD and stuff like that, can also boost their blood pressure. Should they be concerned about that correlation?
This is something that you have to talk about with your physician.
Yeah.
So, especially with the ADHD medications, you've got to weigh the costs versus the benefits.
Yeah, and just keep monitoring it.
Keep monitoring.
Yeah, all right, thank you.